over, and I felt it was important to stay on till the end of the call. But I'm pleased to be here today to kick off our week together. I'll be here every day this week at 1 o'clock, with one exception. On Wednesday, it will be at 2:30, and then every day at 1 o'clock except Wednesday, switching the time to 2:30. I'll begin, as I always do, by drawing your attention to the numbers on the screen. You will see that, unfortunately, there was an uptick yesterday in our number of cases. I don't think it's anything to be alarmed about. We're continuing to increase our testing. We know we're still in the part of the curve where we're on the incline, not the decline. So it's, consistent with what we've been seeing, and certainly nothing to be alarmed about. Also, I would say that what we do know is that we have flattened the curve, slowed the curve, and brought down the peak, which is all fantastic news and a great relief and a great credit to the people of Rhode Island. So thank you all, to businesses and individuals and teachers and parents and everybody who's been doing their best. It's clearly working. As I say, I just got off of the phone with all 50 governors, and we each reported in. And we are doing as well, if not better, than other states around the country, and I just want to thank everybody for their cooperation. Today I wanted to focus the majority of my comments on the work that we've been doing to safely reopen the economy. Each day over the past week, I've been providing a little bit of an update on our work streams as it relates to testing and contact tracing, food delivery, quarantining, etc. And today I wanted to let you into some of the work that's happening in our work stream that we call the new normal. We know that even when we get back to business and go back to school and we come out of our homes, which I hope will be soon, we know it's not going to be the way it was. It's until we have a vaccine, which is about a year away, we're going to be living under a new set of circumstances. We're not going to be able to congregate in large crowds. We're not going to be able to do business the way we used to, but we are going to be able to get back to business, and that is, I think, so important for all the obvious reasons. And I wanted to give you a sense of how I'm thinking about it. I will say I've spent every day of the past 6 years working to improve our economy, and as we came into this crisis, we have one of the lowest unemployment rate our state's ever had. So it's been devastating for all of us to have to clamp down on the economy. As I've done this, my approach has been to be targeted, to maintain a semblance of the economy the whole time, but also, first and foremost, protect the lives of Rhode Islanders. And, some of the decisions I've made have been different than other states. For example, in Massachusetts, they've really clamped down on manufacturing. I chose to allow manufacturers to continue, and by and large, that seems to have been a good decision. Many of our manufacturers have stayed open under very different circumstances to protect employees and Rhode Islanders, and very reduced schedules, but we've maintained some of those jobs, and I want to thank the manufacturers for your cooperation. As I go forward, I'll continue to do that. I want as many people working at all times as is safely possible. Unfortunately, we face some headwinds. Every state is differently positioned in this, and Rhode Island faces some headwinds. I think we're the most densely populated state in the country, either number 1 or number 2. That makes it harder. This is a virus where you don't want to be close to people. We have a very high concentration of seniors, and we love every one of our seniors, but we know that folks who are older, over 70, over 80, are the most at risk with this disease. So as we reopen, we have to be extra vigilant to protect our seniors. We know, if you look across the country, the groups that have been hardest hit are small businesses, particularly businesses with fewer than 10 people. If you look all across America, those are the ones that are the hardest hit. Well, for better or for worse, in our economy, Rhode Island's economy is chock full of small businesses. The backbone of our economy are these small businesses, including the very smallest, 10 and fewer. You know, these are the businesses that they're not tech-enabled, they're not necessarily able to easily work remotely, and so it's harder. It's going to be harder for them to reopen, and it means we're going to have to work harder. We also know, if you look all across the country, unfortunately, the people who are hardest hit are those who are the lowest skilled with lower education levels. You know, by and large, folks who only have a high school degree are getting hit the hardest. And again, unfortunately, here in Rhode Island, we have lots of individuals who don't have a degree past high school or who work in a low-skill, low-wage business, and so that's another headwind. Tourism is an important part of our economy. Tourism has been really hit hard across America, and we will feel that doubly so here. So what does that mean? It means, you know, we're going to get this done. We're going to get it done together. We're going to get everybody back to work. But we need to be honest that we face some headwinds that some other states don't have. When I became governor, when I was elected, we had the highest unemployment rate in the country. And for me, this now is a little bit reminiscent of that. I remember when I started, unemployment rate in certain industries, like the building trades, was 20–25%. And at that time, as your governor, I said to you, we would rebuild this economy together without leaving people behind. And I said then it would be a tall hill to climb, and we would climb it together. And we did. In the course of the 5 or 6 years from that, we went from the highest unemployment rate in the country to the lowest unemployment rate our state has ever seen. And in those industries that had a 25% unemployment rate, we brought them down to a 2% unemployment rate. So what does it mean? It means we got to do it again. And it's not going to take nearly as long this time. We're going to stand our economy back up together. We did it before, and we're going to do it again. And this time we're going to do it a whole lot faster because all of the building blocks are in place. But it's going to require us to be brave. And when I say it's time for us to get back to work, we're all going to have to be brave, even though we're going to be anxious and afraid to go to work or go out to eat or, you know, get our hair done. We're going to have to do it. Confident that the state will have the measures in place to keep us safe. And as I've said all along, we're not going to do it overnight. You know, this is going to be a gradual process based on facts and science, an industry at a time, with different new regulations. You know, right now we're living in a world of no groups of more than 5 in any one place. You know, we're not going to go from 5 to 50 overnight. We're certainly not going to go from 5 to 100 overnight. That's going to take a long time. But we're going to get there, and we're going to go as fast as is safely possible. And for me, I'm going to have to be flexible, and I'm going to ask you to be patient as I change my mind, which might be necessary in light of new facts and new information. But I want you to know that my goal will always be get as many people to work as fast as is safely possible. Now, before we begin, right now, the stay-at-home order is in place until May 8th. So we're not doing anything until before May 8th. It is really my hope that between now and May 8th, we start to see a decline in the rate of infection so that shortly thereafter, May 8th, we can start to loosen some of these restrictions. That I would love to be able to do that. So let me take you through the questions that we're going to ask before we tell you that it's safe to start going back to work. The first question is, has the rate of spread of the disease continued to decrease? So, in other words, does the data indicate that our social distancing has been effective enough and we're starting to see a decline in cases, not an increase in cases? Secondly, do we have the capacity to quickly identify community spread on an ongoing basis before a major outbreak occurs? So we've been working very hard on our testing and contact tracing, and before I say we can reopen, I need to have confidence that we can do enough tests per day in every population. We have adequate contact tracing so that we can quickly pinpoint a problem going forward. Third thing is, do we have the necessary supports in place for vulnerable populations and for anyone in quarantine? So older Rhode Islanders and people with pre-existing conditions are going to have to stay home longer. Those of us who are healthy and younger will obviously be able to go out and get back to normal sooner than vulnerable populations. So when it gets to be the time that I roll out new regulations, they're going to be different for people who are seniors than people who are younger. And that's just because we need to keep everyone safe. It's also important that we know we have the infrastructure built so we can take care of you if you are isolated or in quarantine. So you can get your groceries, get your medicine, get checked in on, have your symptoms tracked. We're making huge progress every day on that, but we're not quite there yet. And if you go on RI Delivers, which is the website where you can find food delivery, you'll see we still don't have quite enough capacity to meet the supply, to meet the demand. So we're going to keep working on that over the next few weeks. Fourth question is, does our healthcare system have the capacity and the PPE to handle future surges? So when we start to let folks go back to work, it is very possible that we'll start to see an uptick in the number of cases. What we cannot have happen is to see a surge that overwhelms our healthcare system. We have more PPE. We're trying to get to a place where we have 30-day supply on hand at any given time. We're not quite there yet. We want to have enough surgical masks so critical infrastructure workers can have surgical masks when they go back to work. And we have to make sure we have enough hospital beds and ventilators in the event that we see an increase. We're working on that. Fifth thing, do businesses, schools, child care facilities, faith leaders, and recreational spaces have plans for long-term social distancing? So for the past month, we've been working very closely with private industry, and we will continue to stay in close contact in the coming weeks. But I'm also going to be asking for very detailed plans from child care centers, colleges, universities, churches, faith groups, et cetera, to make sure that they are all prepared with their own plans in place to maintain social distancing for the long haul, for the next year, in stages, the same way we are going to be in stages. Sixth factor is, are we prepared to reimpose measures or reclose certain sectors of the economy if it becomes necessary? Now, this I want to be very clear about. We never again want to be in a position where I need to do what we've just lived through, what we're living through now, which is a complete shutdown across the board rapidly. I can't promise we won't need that, by the way. If in a month or two we start climbing up the curve, then we will do that. But that's not the goal. The goal is, the reason we're putting in place all this testing, we want to start moving to the antibody testing, is because we want to be able to pinpoint a problem in the future, and if we have to throttle back the economy or do any more closures, it'll be more of a pinpointed closure, maybe just a particular business or a particular kind of business or a particular region or et cetera. And so that I think is quite likely to happen after we reopen. The reason I think that is because that's what you're seeing all over the world. So Singapore was way ahead of it when it came to testing and contact tracing. They came back a little too quickly. They saw a surge. They had to clamp down. Hong Kong, same thing. They were doing pretty well. They let college students come back probably before they were ready, or I don't know, maybe not under great circumstances. They saw an increase. They had to clamp back. The goal is that we'll be able to, if we need to throttle back, do it in a more pinpointed way. And so that's why before I can do anything, before I can start to say we're going to go back to work, we no longer have to stay at home, we have to be really sure that our quarantining, isolation, testing, contact tracing is in an excellent place so that we can pinpoint any future closures, so we don't have, again, an outbreak. Last thing I'll say is this. Right now, there's no vaccine, and there's really no therapy. You know, there's some potential therapies. There are researchers working hard on a therapy or a cocktail of therapies. Even right here in Rhode Island, we have excellent researchers at Lifespan who are working on this. Obviously, if in the coming months there's a medical breakthrough on a therapy that's effective or on a vaccine, well, then that's different. Then we can start to take more risk because we'll feel more comfortable. But in the absence of a therapy or a vaccine, we're going to have to take it slow because, frankly, we can't take the risk of being where we were a few weeks ago. I have been getting asked a lot how our plans compare to what the White House released last week. President Trump and his administration and the CDC put guidelines out at the end of last week for states, and many people are saying, hey, what does Rhode Island think about those? So I thought I would address that directly. The White House calls for a phased approach, phase 1, phase 2, to reopening the economy. And I support that, and we will also be taking a phased approach. We here in Rhode Island are going to be looking at an industry by industry, setting by setting, sector by sector approach, and that is consistent with the White House's approach, only more detailed. And every governor will have to make those decisions based upon their own economy and the kinds of jobs in their economy. The White House and the CDC also call for a downward trajectory of flu-like symptoms and a downward trajectory of positive COVID cases for 14 days. So the White House and the CDC suggest you need to see a decline in cases for 14 days consistently before you can even enter phase 1 of reentry. And our approach is very similar. We support that. We are looking for creative ways to collect symptom information. You know, the testing, we have testing. We're some of the best in America for the number of tests we're doing. We can track number of cases. We're trying to figure out creative ways to track symptoms, so we also have a sense of knowing whether our symptoms are on the decline. Unfortunately, right now, our positive cases are still on the incline, as you can see from the information on your screen, but that's going to change. It will change because social distancing is working, and we will get to a point where we see a decline in symptoms and a decline in cases. The White House guidelines also call for ensuring that hospitals have the capacity to treat everyone without needing to implement crisis care procedures and ensuring enough testing is in place for at-risk healthcare workers. We fully agree with this. You know, Rhode Island is, you've heard me day after day talk about both of these. Right now, we're treating all patients without crisis care standards, and we hope that that continues to be the case. And we are working very closely every day with our hospitals, monitoring their capacity. We've set up a great system with the hospitals where we get a daily information around where they are in their capacity, around beds, ICU beds, ventilators, and PPE. And we're going to keep that going and make sure that we always have what we need. The White House is also looking at many of the same indicators that we are. They say testing and contact tracing. The call that I was just on with the White House and the governors focus heavily on testing, and we are very much aligned with them with respect to that. So I would say overall, the approach that Washington is recommending is consistent with the one that we'll be taking, a phased approach, don't begin before you're ready, and make sure that your system is ready for a reopening. The only difference, if there is a difference, is just we obviously are going to have much more detail, and every state will have to, and I think it was appropriate for the President to suggest to the governors that we are the ones that have to make those decisions in our communities with our stakeholders. I will say this, two other things. I have joined a coalition with a handful of other governors in the Northeast. I'm going to do my very best to coordinate and collaborate with them, all of them. We share a lot of commerce on the Route 95 corridor, so it'll be very important that we have similar approaches. It's particularly important in some ways that we collaborate with Massachusetts. We share many large employers, Fidelity, CVS, Hasbro, Bank of America, Citizens, many other companies. So those companies are going to be looking for similar guidance from both Governor Baker and I, and so we're going to do our very best to coordinate our approach. I do know this. We're going to do this. No one's ever done it before. We are together going through something that no one's ever done before. We are living a global pandemic. We've had to shut down the economy together, and we're going to stand it up together, and we're going to get it done. It should give you some confidence that Rhode Island, if you look across America now, Rhode Island is more than holding its own. We have more testing per capita than almost any place. Our healthcare system is being very well coordinated, and we have an excellent surge plan. We have a field hospital nearly ready to use, was built in record time. PPE is not perfect, and frankly not where I want it to be, but not terrible and getting better every day. And just look at the results. I mean, the results of every case is sad, and every death is tragic. But if you look at where we are today versus where we could have been if we didn't take swift, targeted action, it should give you some confidence, great confidence, that our team has a good approach. The results are there. And as in the months to come, we are all going to have to endure a certain amount of continued frustration and impatience, because it won't be fast enough for any of us, including me. But I predict that 4, 6, 9 months from now, when we are back to work a bit more and living our lives a bit more, you will be able to see that Rhode Island has stayed at the cutting edge of what we're doing. And that's our goal. And every time we'll make a mistake, we'll admit it and we'll change. We'll be flexible, we'll be fact-based, and we're going to get you back to work as soon as we can. And in the meantime, we're going to keep you safe. We're going to do everything in our power to make sure we don't have another huge spike. And we're going to make sure that if you have to stay home or if you're in a vulnerable population, we're going to work overtime to keep you safe and have your needs met. So that's, and by the way, every day this week or most days this week and next week, I will be coming back with more detailed information. We are committed to a very inclusive approach as to how we reopen the economy. I want to give a huge shout out to Commerce Secretary Stephen Pryor and his entire team. They've been working overtime to stay in touch with businesses, and we're going to do that. You know, yesterday I was asked a question about hairdressers. We don't know exactly when hairdressers can come back. It's a close contact business. We don't know the regulations. But I do know this. We're not going to do anything without consulting with hairdressers who are in the business. And I promise you that. And the same for manufacturers, and the same for retail operations, the same for small companies and big companies. We're going to have an inclusive dialogue, as we have been having, and together we're going to figure it out. And we're going to do everything we can to keep people safe. Okay, a couple of other quick topics. I have some good news to share as it relates to SNAP benefits. One of the very unfortunate realities of what we're living through is people are food insecure, and some kids are food insecure, and people who were food insecure when we started this are even worse off. So we're constantly asking ourselves, what more can we do? How can we meet the needs? Last week, I'm pleased to let you know that last week, the USDA Food and Nutrition Service gave approval for the Department of Human Services to issue additional support to the families of nearly 73,000 Rhode Island students who rely heavily on school meals. So, you know, the sad reality is that for many kids in Rhode Island, they get their meals in school. That's the only way they get a decent meal or two a day. And when I had to close schools, it really weighed heavily on me because I knew many of these kids would struggle not only to get an education, but to find a meal. And I want to thank municipalities and municipal leaders and schools around the state who have worked very hard to provide meals for kids, but still it's a struggle. So I want you to know that the new pandemic EBT benefits will give parents with school-age children who receive free or reduced meals $5.70 for each child for each day school is closed, retroactive to March 16th, which is when distance learning began in Rhode Island. So that's about $200 per child so far. For households where our DHS was able to match the child's name to a current SNAP case, they'll receive the March and April benefits today on their existing EBT card. All other eligible families will receive a new card by May 1st, and funds will be preloaded onto those cards that you receive on May 1st. For current SNAP families, if you don't see the benefit today, please wait to see if you get a new card in the mail by May 1st with the money on it before you contact DHS. Some families may receive the card because their child goes to a school in a community eligible district where breakfast and lunch is served at no cost to all enrolled students. So that would be, say, Providence. If you receive the benefit and you don't need it, or you don't want it, you don't want to use it, you can just destroy the card. If you destroy the card, the money will be returned to the federal government. So I hope that was clear. Director Courtney Hawkins is an amazing leader, and she'll be communicating more directly. But the bottom line is we petitioned the federal government for extra SNAP benefits. Rhode Island was the second state behind Michigan to have this approved. If for many of you today, there'll be additional monies loaded on your EBT card, extra money for each child that you have. If you don't receive the money today, wait until May 1st. You're going to get a separate card just with the extra money. Certain cities, Providence being one of them, due to the federal government's rules, the entire population is eligible. That's a decision out of our control. So if you receive a card and you don't need it, I would ask you, we are being asked by the federal government just to have you destroy it, and the money will be remitted to the federal government. So thank you to Courtney Hawkins for your hard work on that, and best wishes as you administer what is a good thing, but will no doubt be a bit of a challenge to administer.